All right, we're going to finish up the different minerals that we started in the last one. All right, starting now with potassium. So some of the functions, just like with sodium, it's important for our water balance, helps determine, again, those electrolytes with osmosis and water coming in and out. Also, like sodium, it helps with those nerve impulses. So as sodium comes in for that action potential, potassium is going out. So we need both of those ions there for our nerves to work properly. Again, it's the main positively charged ion inside of our cells. And increasing potassium intake actually helps to lower our blood pressure because water goes with it, so it keeps water coming in and increasing that blood volume. All right, so if we look at the deficiency in potassium, this is called hypokalemia. Some of the causes, so excessive water loss like diarrhea or vomiting, or laxatives, diuretics, again, all of those are just decreasing, causing a decrease in water. So H2O. Alcohol abuse, different eating disorders, and then very low calorie diets are some causes for this. Now what happens, the loss of appetite, some muscle cramps, again, back to the contraction, some confusion, constipation, and also irregular heartbeats, so some cardiovascular effects of that. So potassium is actually part of our public health concerns for underconsumption. Again, sodium, we worry about too much consumption of it. Potassium is actually part of our plan for increasing consumption. So underconsumption is a concern for the general U.S. population, and low intakes are associated with various health concerns. So we are encouraged to make shifts to increase. Now, where can we get it? As we'll get into, but especially vegetables, fruits, beans, grains, and dairy help to bring that potassium closer to the recommendations. All right, some of the food sources, again, unprocessed food, so fruits, vegetables, milks, grains, as we just mentioned, the beans, also in meat, some of the major contributors, milk, potatoes, beef, coffee, tomatoes, and orange juice can increase our potassium intake. Now, avoiding too much potassium, again, typically food intake does not exceed or lead to any type of toxicity. However, some places where it does become an issue is with poor kidney function. So it's more of a byproduct of some other condition that's causing problems with the kidneys. So if the kidneys aren't working properly, then potassium builds up in the blood, and that can inhibit our heart function and cause arrhythmias and different issues with our heartbeat. So there's not an upper limit or any chronic disease with having too much. So again, it's more of a byproduct of our kidneys not functioning properly. All right, so then our chloride, so back to our salt, so sodium chloride, we already talked about sodium. So looking at our chloride, it's the main negatively charged ion outside of the cell. So again, sodium and chlorine are high, chloride are high outside, potassium and phosphate are high inside. Now the reasons that we need chloride, it helps with that acid-base balance or pHs, especially in the stomach. It's very important for our immune health, helping our white blood cells attack bacteria, and also those nerves functioning properly as well. Now, where do we get it? Fruits and vegetables. Also chlorinated water. So, of course, the chlorine helps decrease bacterial growth, but it does help provide this mineral as well as salt. Now, deficiencies in excess. A deficiency is mainly from, again, those water loss issues. So excessive vomiting or bulimia or some other eating disorders, a large loss of stomach acid due to acid-base disturbances. But again, deficiencies are really unlikely because of how much salt we're consuming. So highly unusual to see this, especially in the American diet. Avoiding too much. So the average intake is elevated, again, because of all the salt. So that can contribute also to increasing the blood pressure. So again, we do have an upper limit when it comes to chloride. All right, now calcium, if you remember, this is the one that we need the largest amounts of as far as our minerals, so we need to consume the most calcium. It doesn't mean it's the most important, it just means we need a lot of it. Now it is essential for bones. It's typically what we think about with our calcium, so that maintenance and repair. Calcium actually makes up about 40% of all the minerals in our body, and 99% of that is used for bone growth. So that's why we relate it to our bones. It's a main component of hydroxyapatite, which is part of our bone structure. In addition, though, to our bones, we do also need it for muscle and nerve functions. Again, muscle contractions do not happen without calcium. So if our muscles don't contract, our heart doesn't work and we die. Also, neurotransmitter release, so how our nerves communicate with each other, and as well as regulating cellular metabolism, like activating different enzymes, just the integrity of the cell. So there's kind of an internal network of proteins that helps with helping cells differentiate or become specialized, and even with our blood clotting formation. All right, so if we look at calcium deficiencies, first just talking about blood calcium levels. So this is highly regulated, and it actually, as far as the amount of calcium in our blood, actually isn't based so much on our diet. So, not consuming enough calcium doesn't necessarily mean our calcium levels are low. Because it is tightly regulated by various hormones, so our endocrine system is vital to keeping our blood calcium levels normal. So what happens here is hormonally bones are told to release calcium whenever the levels in our blood drop. The intestines also are told to increase absorption of more calcium that is readily absorbed as those levels drop, and then kidneys are instructed to retain more calcium. So again, if blood levels of calcium go down, it's hormonally controlled more so than what our diet. Now, some different things that can lead to calcium deficiency besides diet, kidney disease. So again, if the kidneys aren't retaining the calcium and it gets excreted, hormones, again, since that's mainly what's controlling the blood levels, if those hormones that are involved aren't working properly, or some different medications can alter it. Now, regardless of what causes it, what happens whenever we have a calcium deficiency is called tetany. So if you've ever heard of tetanus, there's a bacteria that causes the disease tetanus that we're vaccinated against. But this condition here, tetany, not tetanus, is similar though, because the muscles become very stiff or they twitch involuntarily. And this is because of the role of calcium with those muscles. So they can't relax after a contraction. And also those nerves, again, need calcium to release neurotransmitters. So it creates this stiffening or involuntary twitching of the muscles due to that lack of calcium. So it's just a visual here about the ways to keep the blood calcium normal. So again, a few different ways here to do it. So our kidneys can be told to reabsorb calcium or to reduce the calcium uptake. So our kidneys are controlled by increasing or decreasing calcium. Our bones, again, can either store calcium or they can release the calcium. And again, those are controlled hormonally. So the thyroid releases a hormone called calcitonin, and that is going to actually cause calcium to come in and be absorbed. So it's decreasing the blood, the calcium in the blood. Then to increase the calcium in the blood, again, the intestines are triggered to increase absorption, and that's done by vitamin D. To do that, also, bones can be stimulated to release calcium or to break down, and then the kidneys can be instructed to release calcium from the kidneys, and that's controlled hormonally by a hormone called parathyroid, as well as with vitamin D. So that occurs whenever, again, the blood calcium is low. So we have ways of keeping it the same hormonally. So if it's elevated, calcitonin gets released. If it is low, this parathyroid and vitamin D get activated. All right, now osteoporosis is the most kind of severe effect of calcium deficiencies. So what happens here, we have porous, kind of fragile bones due to that lower calcium density. It's actually defined by either the presence of stress-induced fractures, so again, just normal bones like walking or jumping that normally shouldn't hurt bones, but they do, or there is a T-score we'll talk about here in just a little bit. So the value of negative 2.5 that's looking at that bone density is a way to determine it as well. And then osteoporosis definitely increases in incidence as we age. So in individuals over 50, again, just giving some numbers here. So about 10 million people have osteoporosis that are over the age of 50. Again, even more with a lower bone mass. And unfortunately, that's expected to increase to 71 million by 2030. And this is due to poor milk consumption and dairy consumption that decreases our calcium levels. All right, so then how to classify it? So there's osteopenia, which is kind of the initial stages. This is kind of a low mineral density, but not quite to the point of osteoporosis yet. Then type 1 osteoporosis are those that are postmenopausal, so women over the ages of 50 to 60, and this is due to lower estrogen, so that hormone, so kind of hormone imbalances there. This affects trabecular bone. It causes it to undergo rapid kind of remodeling, so it decreases the integrity. Type 2 is seen in both men and women, again, later as we age, so about over 70. And this is the breakdown of the bone called the cortical and the trabecular. So if you're not real familiar about the bone structure, trabecular is kind of the spongy bone. So this is so if you think about a long bone with the little ends that are kind of knobby, that's where that trabecular bone is. The cortical is the shaft to it. So this is due to a combination of diet and age-related factors, more just not absorbing the calcium as readily. And this is looking at the effects. Of course, osteoporosis causes the spine to kind of curve and decreases the height over time. And then looking at how to measure this, so this T-score, which is a bone mineral density test that can be done. So again, this is the trabecular bone, kind of the ends here is called spongy bone, and then this is, that's the shaft or cortical bone going down through there. Let me just erase that real quick. All right, so then if we do this bone density test, normal bone is higher than -1. That osteopenia is between -1 to -2.5, and then less than 2.5 that indicates that osteoporosis. And these values are based on the desirable density, based on those set up by the World Health Organization. But again, so it's more of a comparative, so where you're at compared to where you should be. So anything above a -1 is okay. Anything below that, we start to indicate some bone loss. So what are some things that we can do to help alleviate this? So again, of course, adequate diet where we get all the right nutrients, also healthy body weight that ensures proper absorption of calcium. Again, estrogen is related to it, so having a normal cycle, so some birth control can alter it as well. Weight-bearing exercises, so like running where you're putting force on it versus walking are better. Smoking lowers estrogen, so not smoking, different medications, getting enough sun exposure to help with that vitamin D that helps absorb the calcium, and then just some moderate intake of proteins, again, phosphorus, sodium, caffeine even, alcohol. So limiting some of these can help ensure proper calcium absorption. All right, so unfortunately another concern here with the public health, so underconsumption more so than overconsumption, like our salts, so potassium and calcium both are on the underconsumption roll. So underconsumption of calcium is a concern. Low intakes are associated with those health concerns, and close to 30% and even 60% of older women do not consume enough calcium. So to promote that optimal bone health and prevent the onset of osteoporosis, again, we need to make some shifts in those patterns to give us nutrient-dense, calcium-rich foods. Again, our dairy, so low-fat dairy, also yogurt, fortified soy alternatives can be used as well. And then even some of the fish like canned sardines and salmon, as we'll talk more about here in our food sources. All right, so our food sources here, again, about their dairy provide about 75% of the calcium for most North Americans. Again, fat-free is the most nutrient dense. Again, it provides the most calcium with the lowest amount of calories, making it more nutrient dense. But there are some non-dairy alternatives as well for those with a vegan diet or who are lactose intolerant. So leafy greens like kale, some of the nuts like almonds, legumes, as we mentioned in the last slide, sardines and salmon, and then also some fortified foods where calcium, is actually added to them. And then again, some dairy-free food options, so some milk alternatives for vegan or lactose intolerant, or other choices here, so soy, rice, almond, and coconut milks. These are some good alternatives. So again, healthy and delicious, not the exact replica of cow's milk, but they can have some unique benefits as well. All right, now if we look at the toxicity with calcium, there is an upper limit, so we can't consume too much calcium. Again, not likely or is not as big of an issue in the American diet, but it can cause some kidney stones if we have too much calcium. Again, thinking about making bone, but unfortunately in the kidneys it creates stones due to too much calcium. High blood and urinary calcium, it can cause problems, irritability, headaches, again, kidney failure. Soft tissue can actually calcify, so the bones that are supposed to be more spongy get too hard, and then decreased absorption of other minerals can occur. So again, there is an upper limit to calcium, but in the American diet, we're more concerned about the deficiency. So then ways of supplementing, because it is not as common in our diet, supplements are common. So again, just keeping an eye on them. Again, not consuming more than 100% of the daily value, thinking about the calcium you're putting in with your diet. So again, keeping it about 500 milligrams or less. Again, looking for that USP symbol to indicate that they're the safest. The FDA does caution against using the calcium supplements from dolomite, from bone meal, coral, and oyster shells because they do have some potential environmental contaminants like lead in them. So again, look for that USP if you're using calcium supplements. All right, so moving onto phosphorus, also another part of hydroxyapatite, same as our calcium, that helps with our bone and teeth strength. Phosphorus, though, is also part of our genetic material. So we need this for cells to replicate and make more of themselves for growth and development. It's also part of our energy source, ATP. That's what the P stands for there, is phosphorus. It's needed for different enzymes and vitamins to work properly. And again, membranes that make up our cells are phospholipids, so they need the phosphate there. And it's also important for regulating our pH and fluid balance. So lots of functions here for phosphorus. So getting enough of it, so it is easily absorbed. It is enhanced by vitamin D, same as calcium. But deficiencies, usually where this is seen is in preterm infants, again, lacking some of the nutrients from their mom later in pregnancy. Again, the vegan diets, alcoholism, older individuals just that can't absorb nutrients as well or don't have great diets, and then also long-term bouts of diarrhea, again, flushing it or releasing it from the system. So where can we get the phosphorus? So it is naturally abundant in a lot of foods, so again, deficiencies aren't that common. Milk, cheeses, meats, breads, nuts, fish, and breakfast cereals, so can too. Actually, about 20 to 30% is added from food additives that are added for like preserving foods, and it's easily absorbed. The majority of it gets absorbed from our diet through the small intestine. And there's just a nice picture here of our trail mix that has a lot of phosphorus in it. Now there is an upper limit. It's pretty high, but we can't consume too much phosphorus, and it causes some tissue calcification because, again, we're increasing the calcium goes with the phosphorus, and can cause some imbalance to that phosphorus calcium ratio that ultimately affects our bones. All right, now onto magnesium. So this is involved also with our bones. About 60% of, or our body stores about 60% of the magnesium in the bone. Again, it's also important in nerve and heart function, muscle relaxation. It helps a lot with different enzymatic reactions, helps resist tooth decay, and also helps lower the risk of type 2 diabetes, the one related to obesity. So these magnesium deficiencies can be caused by, or the deficiency causes irregular heartbeats, some weakness, muscle pain, disorientation or seizures, disruption to hormones, and the regulation of calcium by the parathyroid hormone, and it can affect our vitamin D activity. So now the loss is actually caused, what leads to the deficiency, so heavy perspiration, so sweating, again, prolonged vomiting or diarrhea that's sending that out of the body, diuretics, which are increasing the water. So again, anything that decreases water also decreases our magnesium, as well as alcohol abuse that increases that excretion from the kidneys. So some sources, this is actually found in chlorophyll, which is in our plants. It's the green part of the plant. So our vegetables are our main source here. So squash, whole grains, bran, beans and nuts, milk and meats, also chocolates that's shown over here, and even the hard tap water that has been treated versus soft. So it also has some of these minerals in it. Unfortunately, the refining of grains reduces the magnesium by up to 80%. So either eating enriched grains or whole grains are best. Now, again, we can also get too much of the magnesium, so that excessive amounts can cause diarrhea, and then that ultimately affects other the absorption of other minerals. Now, non-food sources can also cause a problem because dietary sources are rare for us to eat too much magnesium. So that toxicity can occur with kidney failure, the abuse of laxatives and antacids that have magnesium as well. So then iron, again, this is one that is not one of the major minerals. We don't need huge amounts of it, but it is very important. So we're still going to talk about it. Now, its main function is to make hemoglobin that is on our red blood cells that carries oxygen, as well as myoglobin that's in our muscles. So it's very important in order to get for our cells to get oxygen. It also helps make a lot of other enzymes and proteins. It's needed for our brain and immune health. And also it helps to detoxify different drugs in the liver and to make collagen for those bones. So iron deficiency causes anemia. During pregnancy and childhood, we need extra amounts of iron, so that demand is high. So those deficiencies are more common in these populations. But it's actually the most common deficiency worldwide. So about 30% of the world population suffers from iron deficiency. So of all the minerals, this is the one most affecting the world. Now the causes for this deficiency, so growth and increased blood volume. So again, during pregnancy, and then as we're growing, blood loss through menstruation. So those with heavy bleeders, or also blood loss from ulcers, colon cancer, or hemorrhoids. So again, the loss of blood causes a loss of hemoglobin that decreases iron availability. So some of the symptoms, so fatigue, pale skin, very cold, loss of appetite. So again, this is mainly due to that lack of oxygen getting where it needs to go. So the absorption and distribution is affected or dependent on just the iron status, so how much iron is in there. So the form of iron in our food, so there's what's called heme and non-heme iron. Other dietary components in food, so like large doses of zinc and iron, compete. So if we're consuming a lot of zinc, that decreases the amount of iron being absorbed. So the body iron loss is usually, though, pretty minimal. So unless, again, we're bleeding excessively or something, the body tends to hold on to the iron that it has available. A little bit about our microbiome here. So in test tube studies anyways, it shows that iron significantly affects the bacteria that live in our gut. Those bacteria favorably modify the non-heme iron to increase iron availability, so allowing it to be released and absorbed. Specifically, our bacteria here, the Bifidobacteriaceae, it can bind to iron that's present in the large intestine. Now, it limits the formation then of free radicals that are synthesized whenever iron is present, so it helps reduce the risk of colon cancer or colorectal cancer. And then high levels of iron in the intestine actually promote pathogenic, so the bad microorganisms. So iron is related to our microbiome. So the microbiome helps release iron, but too much iron can allow those pathogenic or disease-causing microbes to outcompete the others. All right, so our sources of iron, so animal sources provide about 40% of the heme. So again, our meat and fish, also poultry. The non-heme comes from our plant sources, so our fruits and vegetables, especially our beans, and it can be added or fortified to our grain products or provided by supplements. So avoiding too much, we can't have too much iron. Again, it can affect the microbiome, but it also, causes some stomach irritation. So those iron pills are typically, so again, the supplements are the common cause of that iron toxicity from accidental overdoses. Vitamin C, though, also increases iron absorption. So taking a lot of vitamin C can incidentally increase our iron. So this is a problem with individuals with hemochromatosis, which is a disorder in the iron metabolism, and it that's increased, that is characterized by increased iron absorption and depositing it in the liver and the heart. So eventually it poisons those organs and causes a lot of side effects.